Good afternoon and welcome to our product showcase for Nursing and Simulator Geriatric. My name is Will Trapowskis and I am the Product Marketing Manager for the nursing portfolio. I'm so glad you're joining us today for the beginning of National Nurses Week to learn more about simulation solutions that can help healthcare providers deliver the best possible care to aging adults. As I'm sure you know, the geriatric patient population is increasing rapidly, and oftentimes there are not enough training opportunities available to hone the specialized skills needed to build clinical competence. This can be addressed with simulation training specifically targeted to help prepare clinicians for the complex needs of older adults. The Nursing and Simulator platform was designed based on the input of nursing educators from around the country and mapped to nursing curricula to support training in areas such as fundamentals of nursing, health assessment, pharmacology, medical surgical, mental health, nurse orientation, annual competencies, and now gerontology. In addition to training with Nursing and Simulator, you can utilize a variety of solutions to create comprehensive geriatric training experiences for your learners. From virtual simulation with vSim for Nursing Gerontology to pre-programmed validated scenarios such as Advancing Care Excellence for Seniors, ACEs cases, authored by the National League for Nursing, as well as the ASL 5000 lung solution for advanced ventilator management training. Depending on your learning objectives, we can help you implement the tools you need to succeed. During today's session, you'll have the opportunity to view an in-depth overview of clinical features available with Nursing and Simulator Geriatric, followed by a Q&A session. If you have a question or feature you'd like to see, please type it in the Q&A box on your screen. We encourage you to continue to ask questions throughout the presentation to ensure this is an engaging and meaningful experience for you. Now, I'd like to turn it over to our presenter, Ed Colclough, one of our educational services specialists, to walk you through Nursing and Simulator Geriatric.
Thanks, Will, and thank you all for joining us today virtually. We're really excited to introduce you to our Nursing and Simulator Geriatric version. And I'm glad to be joining you virtually. My name's Ed Colclough, and I am an educational service specialist here at Laerdal. I normally have the pleasure of joining you in face-to-face classes and introduce you to our mannequins, but I'm really excited to be able to do this virtually today. So again, thank you for joining. And we wanted to take the opportunity to talk about our Nursing and Simulator, and specifically our geriatric version that we just released. But before we get into the details of our geriatric version, I wanted to just sort of remind everyone that Nursing and Simulator is an awesome platform, and it is a platform that can be changed. So we really need you to think of Nursing and Simulator as really a platform that can change and evolve to meet your educational needs. Whether that includes clinical skills or diversity training, we have the ability to change. She has the ability to accommodate. So on our bed today, we have our Nursing and Simulator in the full geriatric version, which I'm really excited to see her and to be able to work with her. And we also have our dark-skinned Nursing and Simulator with the African descent module, which is exciting in its own as well. So two things, geriatric and the African descent module, two things that our customers have been asking for some time now. So we're extremely pleased to be able to offer these now available through Laerdal. So we're here to talk about our geriatric version, and again, why? Why is geriatric so important? And I think we all know that, most of the statistics say that by 2030, nearly 20% of all Americans are going to be over the age of 65. We know already that older adults already account for half or 50% of all hospital stays, as well as 3/4 of all home care are for those older adults as well. So, we're really heading into a time where elder care and geriatric care is going to play a bigger role in our healthcare system, and therefore really play a bigger role in our education and learning objectives as well. So we're here today to show you really what's available in Nursing and Simulator and as far as her geriatric features, and again, excited to do that. So before we get started about the geriatric features, let's just briefly review some of the things that are important to know about the Nursing and Simulator platform, and that is we can operate it by SimPad, or we can operate it by Leap. So if you already have one of these operating systems or familiar with the operating systems, it's the same intuitive, easy to use software that you may be familiar with other simulators. can operate our nursing and simulator. So again, the SimPad can operate it, or the LEAP software. So today we have both of our simulators operating, and both being operated by different software. So our African descent simulator is actually being operated on our SimPad, and our geriatric version is being operated by our LEAP. And we see also that you're going to see throughout the course of this that we also have her connected to our simulated patient monitor as well. So for the purposes of today's demonstration, I just want to do sort of a head-to-toe sort of review on some of the different features and give you an idea of some of the clinical skills that can be performed on her, as well as hopefully have you tie those skills into some learning objectives. So I hope as we're going through, you're going to take into consideration some of your learning objectives and tie them into some of your learning or your students' learning needs as well. So let's get into it, and we're going to do a head-to-toe, a physical head-to-toe, just like we would with a real patient. We're going to talk about some of the unique features, and I want to remind you that some of the features sound really small, but could be very significant in your learner's experience, right? Remember, the fidelity of the experience is as important as the fidelity of the mannequin. So understanding how to tie in little features that increase that level of fidelity for your student, right? Because the ultimate goal is to dispel disbelief and get learner engagement, which is very important, right? And often it's those little things, right? The things that we note just as we walk into a real patient's room, we note as we walk into a simulated experience. So having a simulator that is responsive and reactive will indicate something for your learner, right? Just as a real patient would. So when we look at our nursing and simulator here, we notice she has a stylish yet functional hairdo appropriate to her age, right? So it is actually a wig that is removable. So we could simply remove the wig and replace it with another one. So again, you could have multiple wigs to set multiple settings. So maybe you want to have a wig that's matted and not cared for. Maybe the simulation you're trying to get across is an elderly person in a home care environment that isn't able to look after themselves. How do we get that message across? It's through the subtle cues like the hair, right? Things like that. And we'll talk about other cues as we go through. But think about the wig as being able to ramp up the fidelity of the experience. Or maybe it's not a wig. Maybe the patient is undergoing a certain treatment, radiation or chemotherapy that's lost their hair, right? So that may be indicative of the treatment and their underlying medical problems. So again, right from the beginning, think about the little things that are going to enhance your learner's experience. As we move down, you can see that her eyes are blinking. So her eyes are blinking, and we can control that. So we can make them blink faster or slower. So if I wanted to represent a patient that was maybe obtunded and not as alert, I could do that just through the eye movement and things like that. Again, the subtle things that your students and your clinicians notice on a real patient. We can change pupils. So she has the ability to take the pupils out of her eyes and replace them with the one that is appropriate for your scenario. So we have, and I was really excited to see this, we actually have a cataract pupil now. So again, given this is a geriatric age patient, right? We know in the aged that cataracts aren't uncommon. So again, having your learner actually assess the pupils and notice a cataract in one or both eyes is, in my mind, that's really cool. That's really ramping up your fidelity and your experience for your student. Of course, you can have it dilated if you wanted to mimic a stroke. You could have them pinpoint if you wanted to sort of do that accidental opiate overdose. Again, she doesn't have any hair. She's on a home care, she's got a medication pump, and she's maybe accidentally overdosed on an opiate. Maybe her pupils are pinpoint, right? We can change them very simply. Suction cup allows you to remove them and change the pupils. Very, very easy to do. Again, combined with her blinky eyes, really gives you a good insight, right? We haven't even got to her nose yet, and we're already getting a better insight to what's happening with this patient. And that leads us to her nose. She does have a nose, obviously, but we can put tubes up there. So if we wanted to put an NG tube, like we have it in our African descent module simulator, we could do that with our geriatric version as well as any other tubes that may be relevant to your clinician's level of practice. So that may be a nasal pharyngeal airway all the way up to nasal intubation if that was a skill set that you wanted to have then perform during their simulation. So really advanced airway. That brings me to her advanced airway. She does have a very sophisticated airway, so you can manage her airway through her nose nasally, obviously, or you can go orally as well. So if you wanted to put an LMA, an oral airway, intubation, you can absolutely do that. You can expect to be able to manage her airway with or without an airway device as well. So we could do bag valve ventilations, right? We could do that very easily. We could actually administer oxygen to her as well. So we could put a mask on her, or more commonly, again, our chronic patient may be on a nasal cannula. It allows for us to put a nasal cannula on her as well. And it's really kind of cool. She has improved ears, if that makes sense. And if you notice, the tubing goes around her ears. So it allows us to actually put the nasal cannula on and have it stay in place. Because one of the features we're going to see is how well she articulates in the different positions we can put her in. That's really exciting, and that's going to come up a little bit later. But again, we can manage the airway, we can deliver oxygen. We could even ventilate her with a bag valve mask ventilator. So if I wanted to BVM and just do a manual ventilation, I could do that. So again, oral care may be important to some of your disciplines as well. So taking care of her oral care needs as well is very important for a lot of clinicians. With our geriatric module, we're pleased to tell you that she does have actually even aged teeth. So we've gone to the detail of actually providing her with some aged teeth as well. So when they look into her airway, they're going to see teeth that are actually appropriate for a geriatric patient. And hers is actually even missing one. It's kind of cool. So a lot of attention to detail on our geriatric simulator to really represent that advanced age. Again, you can see on her face the age spots, the droopy skin. You can see all the things that you would expect to find on our aged patient. Again, her ears allow us to put the nasal cannula on, but allows us to assess in the ears as well. So you can use an otoscope and look in. You could clean out the ear if you wanted to do basic hygiene and care. You could do the cleaning of the ears as well. As we move down her airway, again, at sort of an advanced airway, we see a little slot on her neck that allows you to actually put a trach tube in. So we can actually have her trached and ventilated accordingly. Again, not to really simulate the actual procedure of inserting a trach, but more importantly to actually for trach care and airway management. Again, what you would expect to see the majority of your clinicians doing, maintaining that trach and caring for it. So one thing I did forget to mention is she also has the ability for a central line. So if central line maintenance and care is part of your curriculum and you want to tie some learning objectives to that, you can certainly do that with our nursing and simulator as well. It allows you to infuse fluid and so forth. Again, as we move down, I'm going to expose her and we can see sort of her chest skin and some of the detail on her chest skin and her abdomen as well. So things you would expect to see with an aged patient. Again, the age spots, the wrinkly skin, those kind of things as well. We also have the aged skin and age spots represented on her arms and her hands, which is pretty cool. New for the geriatric module is this little catheter or pre-ported IV catheter. So it actually allows you to pass the IV catheter in and attach it to tubing and then safely drain the fluid out with no mess. So in other words, you don't have leaky holes where previous IV catheters have penetrated, things like that. It actually allows you to then evaluate your learner's ability to manage volume and rate and all those kind of things that are important, right? So again, allows you to take a traditional IV catheter, pass it, secure it like we have here, and then manage it appropriately, again, with the right, correct volume and rate. So really important. She also has pulses on her arms bilaterally, so we're really excited about that as well. Our previous nursing and didn't necessarily have pulses on both sides, but our nursing and simulator now has pulses on both sides of her arms, both arms I should say, and has both brachial and radial pulses, so that's exciting. And get this, you can actually do a blood pressure on both arms now. So now you're not relegated to one arm only. You can actually do a blood pressure auscultation or by palpation on either arm. So really exciting. And again, that's consistent throughout the nursing and simulator platform. You can do it on both arms. So whatever module or whatever mode she's in, you're able to do that. She does have carotid pulses as well, so you can feel those carotid pulses. Again, her chest skin represents that aged patient, and we can auscultate lung sounds in 4 areas on either side, so 8 areas specifically on the anterior aspect, 4 for her abdomen, as well as her heart sounds. So amazing ability to auscultate different sounds, all the sounds you would want and expect, lung sounds, heart sounds, and abdominal sounds. And I'm just going to show you, again, how well she articulates to show you some of the sounds and where you can auscultate on the back as well. So she sits up very well, so we can sit her up, which is kind of cool. So again, in a normal position, what you would expect to find a patient, but we can actually go even a step further now and put her into sort of a tripod position, right? That patient that's having that severe respiratory arrest, you would expect them to be sitting forward, all right? Also allows you to position the patient to do any of those procedures like nasogastric tube or so forth. Again, now that she's sitting upright, you can expect your learners to be able to auscultate again in 8 different areas on her back. So she has anterior and posterior lung sounds, which is pretty exciting in itself, right? So from a respiratory assessment, if you're doing respiratory assessment module, then you definitely have the ability to meet all your learners' needs as well. But again, this definitely illustrates, again, how well and maneuverable she is. So again, think about basic learning objectives like patient safety and things like that, transferring of a patient from a bed to a wheelchair, those kind of things can all be achieved with the Nursing and Simulator. It really allows the simulator to be articulated into a position that is better for assessment, better for treatment, whatever you have a need for. She articulates very well, and we'll see her legs articulate in a moment. But I'm going to sit her back now. We're going to make her a little more comfortable. We've relieved her respiratory distress. Again, notice the range of motion on her head is very lifelike as we lay her back. Again, just like in any simulation, we'd always treat our simulator like we'd treat a real patient. Give them the same level of support and respect. Again, if we're looking at her abdomen, you probably won't be able to pick up on the camera because they're tiny, tiny little holes. But what they serve is our ability to do and to put these ostomies in. So we have 3 different ostomy little modules that we can add on there, and we can have the normal, we can have the infected, or we could have the non-perfusing dusky ostomy on there as well. There's 3 holes. You could have all 3 of them. Obviously, you wouldn't see that, but again, we could, again, different modules that come with your Nursing and Simulator platform. So this is part of the basic platform, but obviously could be used in the geriatric model as well. And we can see her tummy, again, wrinkled and a little saggy like you would expect to see in the aged patient. Again, she currently can be configured either in a female or a male. So right now she's currently configured as a female patient. So she has female genitalia in place. And again, we do have the ability to obviously pass a urinary catheter. So we can interchange the genitalia as well. So here is the aged male genitalia. And again, we could pass a urinary catheter and literally have output. And you can see here, we have her catheterized and she does have a fluid output. We can also do rectal administration of both medications and enemas as well. And obviously in the female version as well, she does have the ability for any vaginal treatments and administration and so forth. So again, interchangeable genitalia to go from the male or the female version. Again, her legs articulate well. Again, allowing for great articulation when doing patient care-centric things like insertion of a urinary catheter or basic hygiene and care. You can certainly do that. on our geriatric version, even the feet are aged and really well, to be honest with you. You can see the veins, the feet look a little emaciated, but they still have that pedal pulse that you would expect as well. And again, she does have femoral pulses as well. So again, just a quick recap of her pulses. She has carotid, brachial, and radial bilaterally, bilateral femur, and bilateral pedal. So pedal, femoral, radial, brachial, and carotid pulses bilaterally, which is, in my mind, really exciting. It doesn't limit your students at all. So great. And again, the feet are aged and represent that geriatric patient. Same with the arms and so forth as well. And again, bilateral IV starts that we can do. Okay. So again, a few other little features that before we leave that may be important to some of your disciplines is that she does have the ability for certain injections. So she does have injection sites throughout her body that allow you to give fluid, deltoid, and on her sides here, so you can actually administer different medication, and fluid. So there's areas where you can administer fluid, and in her femur as well, you can do injections, but they have to be dry. So there's multiple injection sites on both sides, as well as, and this is really exciting, and I know some of our customers are really excited about this, and under her skin, you can place these subcutaneous injection pads that allow you to do subcutaneous injections as well. So pretty exciting there too. That allows your students to do that. And these are wet injections. They can actually inject fluid. There's a little pad that absorbs those fluids as well. One of the other great things that you can do for her is dressing. So the adherence of dressings and other things, whether it be for ostomy care or for trach care, things like that, or any post-op surgical sort of care. We also have these silicone dressings that allow you to apply the appropriate dressing without damaging the skin. So you put this down first, then you put your standard patient-centric dressing on top, and it will adhere perfectly to that as well. So again, if you're practicing that model of practice like you're going to play, that old saying, they can use the patient-centric devices right on the nursing and simulator skin without causing any damage. So I think that's nursing and simulator. I hope you found this helpful. I see we've got some questions that we're going to get to, so I'm going to turn it back to Will, and we'll answer some of your questions. And again, thank you very much for taking the time.
Awesome. Thank you, Ed. That was a great demonstration of nursing and simulator geriatric. There's a couple of questions I see in the Q&A chat here. Just to start out, are there any feature or functionality differences, between the younger and older version of nursing and simulator?
So great question. No. Short answer is no. So the clinical features and the functionality of the mannequin remains the same. So think of nursing and simulator as a platform. She's a fabulous platform. So if you have the younger version, you won't lose any features or any functionality going to the geriatric version. Majority of the differences are cosmetic. There are some features, like we said, the cataract in the eye, things like that. But the functionality, the clinical functionality, the mannequin, and even the operation of the mannequin remains exactly the same if you have the younger version or the geriatric version.
Great, thanks. There was a couple questions about the aged teeth. So are they removable, and are they sold separately, or will they be available for sale separately?
Yeah, so most of our mannequins actually do have removable teeth. I have a set here. Actually, the ones that came out of the younger version we have here. And again, they simply slide into the hard palate at the top. And I can take her teeth out, and you can see. So they are actually aged. It's actually pretty cool detail, actually. So see how easily they come out. And again, we can see they're aged, and she's even missing a tooth. So again, the same component, again, just slides in, positively locks into the upper palate, and you can switch them in and out. So we see on occasion people doing airway maneuvers. Your learners may chip a tooth or damage it. So yes, they're absolutely replaceable. They are available as a replaceable part on our e-commerce site, and you can do that.
Great, thank you. About the size of the simulator, height and weight, and kind of a little more info on that.
I think she's about 70 pounds and comes in at 5'6" for her total measurement.
You went into the SimPad Plus and the Leap software just a little bit. Is there an advantage of buying either of them, or could you give us a little more detail on those two?
Yeah, so both the SimPad operating system and our Leap operating system are both very easy to use, very intuitive, and you don't really have a difference in the functionality or the operation of the actual mannequin. Where the advantages are is really how you intend to use it. So the SimPad itself works very well for that bedside learning opportunity where you may be next to your students or close to your students and either coaching them or whatever style of simulation that you would like to do. The Leap software on the PC works just as well, but again, is a little bit better suited for, say, the control room environment where you have a separate space or you have a table which you can set the actual computer on and you can run it through the actual software. Now there is one exception, and that is if you want to use your nursing and simulator with a ventilator. So if you want to use a vent, you're going to have to buy an optional piece of equipment called the ASL 5000, which is great for ventilator training, works very well with the nursing and simulator, and that you will require the actual Leap PC to operate that particular feature if you choose to select that. But otherwise, its normal clinical functions and its use can be operated either by the SimPad or by the Leap software, and you just pick which one is best suited for the environment that you have.
Great, thanks. And speaking of software, are there gerontology or geriatric scenarios specifically available for nursing and simulator?
Yeah, so some of our great partners and our authors on Scenario Cloud have authored some scenarios that are there. So I would encourage everyone to visit Scenario Cloud, whether it be for the geriatric scenarios or just to visit and see what's available. Currently, we're having a 90-day free trial, so you can go to Scenario Cloud and get your free trial and download these scenarios as well. You can browse and search. It's a very user-friendly interface, so you can search by the mannequin you have or the skill that you want to look at. But yeah, please visit Laerdal.com and visit our Scenario Cloud and see the geriatric one specifically.
Great. We actually had a question about where the fluid goes when you administer it. Could you go into a little bit more on the internal reservoirs and maybe show everyone one of them?
Sure. So there's a couple reservoirs. So I heard in that question, where does the fluid go when I administer it? So if I'm actually administering fluid through the IV, it's actually going to go in the arm and it comes out the back. There's a tiny little port in the back that connects to a drainage bag so that fluid is safely controlled. If the question is, how do we add fluid to the actual reservoir bag? That's easy as well. We're just going to expose our nursing and simulator here. I'm just going to zip up her abdominal skin and remove it. And I'm going to slide it back and we're going to expose a abdominal plate. And in this abdominal plate, we see little quick connect tubes. This allows us to take a large syringe and connect the syringe with our appropriate fluid. Now remember, we have 3 reservoirs under this plate. We have a reservoir for our urine, we have a reservoir for blood, and we also have a reservoir that simulates her stomach as well. So we can place fluid in any of those simply by connecting to the appropriate one. You probably can't pick it up on the camera, but they're all each individually marked and color-coded. And when you push the fluid in, it goes through and into a reservoir, the appropriate reservoir bag, and we have that bag here. Here we see the urine one that's color-coded yellow, very appropriately. There's a color-coded red one, and you can imagine it's for the blood, and then a green one for the stomach. And these are the extension tubes that come up through the abdominal plate that we're connecting to, and we're inserting the fluid in. Because it's her bladder, she does have a connection here that goes out, and then when we catheterize her, so this connects to her genitalia, and when we catheterize her, the balloon sits in here and fluid comes in. Each reservoir accepts approximately 500 mils of fluid and about 300 mils of air, and the air actually helps push the fluid out. So I hope that answers your question. If it's the internal reservoirs, easily through the abdominal plate for a quick And again, that really facilitates a quick recharge if you're doing multiple scenarios in a row. If it's about administering fluid through the mannequin via IV or central line, it comes into the mannequin and goes safely out into a receptacle bag that is sealed and allows you to recover that fluid safely.
Alrighty, yeah, thank you. I actually have another question here. The subcutaneous lining, does it need to be removed after each use?
So not necessarily after each use as far as administration, but again, if we pull the subcutaneous injection pads out, you will see there are actually two parts to them. There is a foam part that sits under the abdominal skin and a pad that soaks up that fluid. So again, as the needle penetrates and as we put fluid in, it's absorbed through this. So when this becomes saturated, it's important to remove it. So not necessarily for each injection, but at the end of each scenario or simulation day, you should be really removing this as well as this. This is reusable, but you wring it out and you can reuse it, but allow it to dry. The biggest risk with the fluids is actually mold. So you just want to make sure that you allow it and you remove it. So again, this will soak up the majority of the fluid. You just, again, they are replaceable and disposable, so we get rid of those and we can multi-use this foam. But again, if you buy the replaceable part, and again, these parts are available on our e-commerce site, they're a consumable item, right? Because they're intended to be used for a limited amount of time. But you should be able to get multiple injections, but it's going to depend on the amount of fluid and how you administer it and how often you will have to change it.
The fluid bags, can they be removed for cleaning and disinfection?
Yes, they can. So again, this is the actual fluid bag, and that's a great question, and thank you for asking, because I know some of our concern is how easy it is to remove it, clean it, and again, to prevent any molding and make sure that you're protecting the longevity of your mannequin. So absolutely, each bag, each reservoir bag is identical with just different ports and color coded. So they're absolutely the same. They're easily removed. They attach inside by these two tabs and can be easily removed. Oops, going to drop the cap, but easily removed, drained, and then left outside of the mannequin to dry safely and then put back in when you're ready to go again. So.
Thanks. And then as far as the blood pressure, is it automatic or how is it usually taken?
So with your blood pressure, you have a few choices. So you have, obviously we see her with her blood pressure cuff on. So again, this is a normal blood pressure cuff that your learners would expect to do a manual blood pressure, right? So they can actually pump up the blood pressure cuff and get the proper result. So they can take a manual blood pressure by palpation or by auscultation. So if I had a stethoscope, there's a small speaker in here that you can hear your sounds, or you can, again, take it by palpation. So we have the option of manual by palpation or auscultation, but we also have the option of using our simulated patient monitor to do a simulated NIBP, or non-invasive blood pressure. So really you can do it three ways: manual by palpation, manual by auscultation, and then again by NIBP, or non-invasive blood pressure. And you can switch back and forth between any of those methods during out the scenario. So if your local protocols are, you're going to do a manual blood pressure first, and then you're going to continue on with NIBP as you continue to treat the patient, you can switch back and forth if you like.
Great, thanks. We've actually had a couple questions about changing her pupils. Can you change her blinking too as well?
So yeah, so again, her pupils are interchangeable, but we can actually control her eye movement as well. So through our LEAP software, either by the SimPad or by our LEAP software, and we have it up here, it's easier for the camera to see, you can see there are actually icons on the screen to represent her eyes. So we can't change the pupil size that we do manually, but we can change how quickly she blinks. So if she blinks normal, rapid, or slow. And we can also close her eyes. So if we wanted her to have her eyes shut or partially shut, we could control her eyelids as well. So her eyes are somewhat controllable in that fashion.
Great, yeah, and it's awesome that she has cataracts actually available as well.
Yeah, it's a great option. It's again, attention to detail with the geriatric kit is awesome.
We've actually had a couple questions about upgrading from nursing and simulator, say I owned one already, to geriatric. I know you may need to take some of the skin off, take some zippers off, but could you demonstrate kind of, how you could do that with maybe the foot or something?
Sure. So we expect our customers to think again as nursing and simulator as a platform, right? So we expect that a lot of our customers will have her younger version and use that the majority of the time, and then need to convert her on occasion to a geriatric patient. So it's made to have that happen very easily, and it's a series of skins. So again, it starts with her feet. So again, we can see how easy her feet will come off, or skin off her feet, I should say. So again, it's not difficult. It's just a little. Again, it's all brand new rubber, so we just have to be patient. So it may take about 10 or 20 minutes, depending on how proficient you are. But again, we simply just take the skin off. So again, we're taking our geriatric skin off, but we would be putting our normal skin on, or taking our normal skin off would be the same way. So again, we have a simple skin. So that's her foot. So that's how easy it is. You notice there's a little white powder. That's just simply talcum powder. So you use a little talcum powder, helps it slide on a little bit quicker. As we move up, she has aged arms. So her arms are quite detailed. And I'm gonna maybe take the blood pressure cuff off of her arm here, so that we can see our arm a little bit better, because I'm really impressed with the detail. Again, the skin is aged, looks really good, right? So if we wanted to take this off, we would just remove the chest plate, which I'll do in a second, but I just want to show you the arm. The arms they actually come complete, so we just have an arm. It's a pin in a socket, so really easy to replace, and a quick connect cable that allows us to plug in. Because remember, she has bilateral pulses and blood pressures on both sides, right? Which is really unique. So we need power to those arms as well. So really easily changed. But to get to the majority of the skin, again, we're just going to take her gown off here so that we can expose her and we can see her geriatric skin here, right? So again, we have the aged skin on this particular nursing and simulator. I'm going to unzip her skin up the side here. And again, a little awkward. Normally I'd be able to walk all the way around the mannequin, but for demonstration purposes, I want to turn my back to you guys. There's a little flap and a little plug in her pelvic area. There is a zipper on the other side, and I'm going to unzip that. And that frees up the abdominal, the anterior skin. I have to remove her wig because her face and head skin comes off as well. And again, just going to gently remove our pillow. The pillow down here. And I'm just going to unzip. So again, there's another zipper that goes around. It goes all around her head and down her other side of her neck and on her shoulder. She no longer needs her nasal cannula, I would imagine, since we're taking her skin off. So we'll hang that up out of the way. And now I can just gently peel back the skin. There's a few connection points where they just plug in to secure to the face. And I simply just remove the skin. So it's one piece skin that allows me to remove it. Again, the camera can't see it, but we have connection points in here we can release, take off the arms, and put them back on. Again, we have foam for her breast and her abdominal area to fulfill the saggy skin, so when your students are palpating. And again, it would just be a matter of easily reapplying either the geriatric or the regular skin. So we can see how easily that goes back on. And again, we can just align the face. The plugs. There we go. Again, once you get better at using these zippers and so forth, it goes a little bit quicker, but you can expect the first couple times not to necessarily go this quick.
Ed, while you're reattaching the skin, just there was a question about cleaning the skin, just dealing with COVID, cleansing between students. Is there any recommendations for that?
Yeah, so that's a, given the current time, that's a great question. So I think it's good to pause from the skin and maybe talk about that for a moment. So you absolutely, soap and water is your first agent to clean, and then to sterilize, we suggest you follow sort of the CDC guidelines, and most alcohol-based cleaners that are recommended by the CDC are safe for use on the actual skin itself. Okay, but that's a very good question.
I know that there is actually a quick setup guide available on Laerdal.com for the Nursing and Simulator Geriatric to remove the skin in greater detail.
Yep. Absolutely. And don't forget, we always have our great tech support team to answer any questions and talk you through any of the questions you may have in regards to replacing skins or any other parts or pieces that may need to be replaced. All right. So I've just zipped up her head. I'm going to put her arm up. Any other questions I can be answering while I'm zippering here?
Yeah, actually, before you zip her, could you sit her up and just show the tripod position quickly?
Sure, that'd be great. So again, our patient, so one of the great features with Nursing and Simulator is how flexible she is. She can actually be put in multiple different positions, including the sitting position. And she has great articulating arms. So we can see her arms articulate, her legs articulate very well. So we can actually have her sitting in a bed. We can have her sitting in a chair. And again, we can see her legs articulate very well. So if we want to sit her up, and again, I've taken the arm off just to show you, but we'll sit her up. We want to do it like we would with a normal patient. We want to give her some support. You want to protect your patient. And again, we're going to sit her forward, and you can see that she sits forward. So again, I've got the arm disconnected here just to show you how easily it comes off. But again, we can see that she sits up. Okay.
All right. Yeah. Thank you. Sorry, I know it's she's kind of in pieces there, but
yep. Sort of multitasking. I want to get to as many questions as we can, so thank you. Excellent.
You mentioned the tech support. Is there anything additional that a customer may need for Nursing and Simulator Geriatric as far as training or services?
So we have a great deal. That is what I do as an educator. We're proud to offer some best-in-class educational opportunities. So Nursing and Simulator, there are certainly a group of educational opportunities for Nursing and. So we can have face-to-face class, virtual-led instructor training classes to support the use, to really get you to be fully familiar and comfortable with her complete operation as well. So absolutely, educational services that support her features and functions and her use. We have technical support. We also have a great team of field service engineers who will come and help you, or will actually come and install the Nursing and Simulator for you when you purchase her. And we have a great bench team here as well. So we have a great team of service individuals that can fix and repair, do preventative maintenance. We would certainly encourage you to consider some of our preventative maintenance programs as well, whether that be on-site or return to bench type of service. So right from the beginning, from arrival to setup to education to continuing to support you to make sure that your program's sustainable as you move forward with your Nursing and Simulator.
Great, thanks. Yeah, there was actually a question about temperature and pulse oximetry. I'm sorry. Are there any special devices that need to be purchased or used with Nursing and Simulator?
No, so we know temperature is a big thing today with COVID especially, right? It's one of the first things we want to assess on the patient. Temperature can really be communicated through the simulated patient monitor, including all of the parameters that you would normally expect to find on a cardiac monitor. So through our simulated patient monitor, we can communicate, or we can actually display temperature as well as SpO2, heart rate, end-tidal CO2, even invasive pressure monitoring and so forth. All the parameters that you would expect, including invasive temperature. So we can actually it actually reports blood temperature as well if you would like to be that sophisticated. There is no physical connection to the mannequin required. So if you think of your Nursing and Simulator and your LEAP software and your simulated patient monitor as a system, a computer, a small little network. They all communicate to each other. So whatever you have selected will be reported on the simulated patient monitor. You can just use any sort of probe if you want, because again, we see some of our customers want to have that actual probe. They want to see their learners connect the probe to the right area and then get the result. So you can certainly use and mock up any sort of SpO2 or pulse oximetry cable that you have, or end-tidal CO2 into the nose or anything like that, and actually have it cabled back to the actual simulated patient monitor to add a little bit of fidelity and realism and actually make them manage working around those cables. But no cables are required. It will absolutely report whatever it is you want it to be as the instructor. So again, full parameters, including SpO2 and temperature.
While we're on the subject of the monitor, can it be configured to a simpler version?
Yes, so there's a variety of different versions that or views that you as the instructor can activate, or your students can change to. So there is a more basic version that has less parameters. We can get rid of the invasive pressure monitoring and some of the advanced telemetry type of monitoring that most of our customers don't utilize. It can absolutely, and it's easily done. It's actually through the actual patient monitor. We can just touch a button and change it. Or you as the instructor can tell the monitor what it should look like even before you start the scenario. So it's at the discretion of the instructor, but also within the control of the student if they want to add or take away some of those parameters as well.
Thanks. Do you know, will she work on a ventilator?
Yeah, so again, that's a request we get quite frequently, especially given the COVID days. She works very well on a ventilator, but she would require that ASL 5000 that I spoke of earlier, and would require the actual LEAP software. So you'd have to get her with the LEAP PC and the ASL 5000, and then you could use the majority of the ventilators on the market today, and she would interface appropriately. We'd be happy to get into details about that if you'd like us to follow up and send you more details about that.
We've had a few questions on injection ports, I believe, in her arms. Could you just show them and where they are and maybe demonstrate if possible?
Sure. So she comes with a pre-ported IV. So I'm going to use her arm that's sort of disconnected, and maybe we can sort of, actually with the geriatric one, I'm going to show you actually maybe on this side. This arm's free. So we actually have this new style of an IV port. It's actually it allows you to actually pass through the catheter. So again, I'm sorry, I don't have a real catheter with me right now, but you would take your real IV catheter and you would cannulate through this little hole here. And the purpose of this, it allows us to actually do the psychomotor skill of the cannulation and actually remove the needle and then infuse fluid without it leaking, right? So we think of traditional models where we actually have a little vein underneath, and every time we puncture it, there's the potential of leaking under the skin. This new system reduces that potential of leaking after it's been punctured once or twice or multiple times, and allows you to still do the psychomotor skills of the actual cannulation, secure it in place, and then administer the fluid safely, and allows you to go out of the actual out of the mannequin into your receptacle, whether that be a drain bag or even a simple bucket, however you have it configured. But again, it allows you to pass that through. We have her here, again, on both sides. It's a bilateral IV site. So I'm sorry I don't have a catheter, but if you can imagine just inserting the catheter like you would normally do, it does not change your approach or your clinical practice in any way. It's exactly what you would normally do to cannulate an IV. It allows you to push off the needle, pull it out, and then actually connect. And again, obviously connect with your IV tubing. And again, we can, take our IV tubing and connect it to whatever catheter you had on that side. So again, with the catheter in place, I could connect and then secure my IV as I normally would. Okay, I hope that makes sense.
Yeah, thank you. As far as breathing, does the simulator have chest rise when you're simulating breathing as well?
Yeah, so in addition to her superior lung sounds that you can auscultate, she absolutely has chest rise as well. So you can see the chest rise accordingly, and it obviously matches her respiratory rate.
Alrighty, I think those are just about all of the questions that I'm seeing in the chat.
That's great. Some really good questions. So thank you for asking those fabulous questions. I think some really good questions there, especially the cleaning and so forth. I know those are a lot of things on people's mind today.
All right, great. Well, thanks, Ed. I think I'm going to wrap it up now. So just wanted to say thank you so much, everyone, for taking your time for our presentation today. I know some people may have asked for this in the chat, so you will receive a presentation of this recording via email in the next coming days. In addition, your local Laerdal representative will actually be following up with you to answer any additional questions you may have if you're interested in anything else about nursing and simulator, the entire platform. You can actually visit the URL on the slide that is about to be shown. And I hope everyone has a great day, and thanks again for joining us.